When Lily came to us, she was very young. She had an unusual and very rare cancer, and she had a lot of bleeding, so this cancer needed to be addressed right away. It's rare in adults. This is the only time I've seen it in a child.
So Lily had a clear cell carcinoma of the vagina, which is a very rare type of cancer that women get in general, and it's even rarer to get her at her age. Her cancer was so advanced at the time of the diagnosis. Usually, surgery was not an option for her, so we had to treat her with a combination of radiation, which was a primary treatment, and then we also gave her small doses of chemotherapy during the time that she was receiving radiation, just to help the radiation work better.
In order to make a tumor like this disappear, we have to put in a lot of radiation, and to do that, we put the radiation right inside the tumor. And our targets in this case are not just the tumor and its organs, but the lymph nodes that surround it, because those can get cancer cells that are microscopic that seed in those lymph nodes. And so the first thing we do with external radiation is we shrink down the main tumor and we get rid of any microscopic cells.
I always tell my patients and their families, a lot of times women think, oh, I'm just having some spotting between periods, this is normal. I always encourage women to seek, medical attention for an evaluation, because a lot of times abnormal bleeding in between periods, and certainly bleeding after menopause is not a normal symptom. So I always encourage women to seek help if that is the case. Very healthy. Her exam was totally normal, so she remains without any evidence of disease of her cancer recurring. And I just learned she's going into nursing school, which I think is great. And I think we're all very proud of everything she has accomplished, and the fact that we were able to help her along the way to get her to where she is today is very inspiring.